The Indiana Supreme Court takes a stand for right to work, and the president announces a major policy change with repercussions right here in Northwest Indiana. These stories and more coming up next on Lakeshore Report.
The Indiana University Northwest School of Business and Economics is the only public institution in the region to hold AACSB International accreditation. The program provides undergraduate business education with a balanced curricula based in leadership, teamwork, and technology. IUN serves both traditional and non-traditional commuter students in a diverse urban environment. Learn more at iun.edu/business.
In a unanimous decision this week, the Indiana Supreme Court upheld Indiana's right to work law. The measure bans union contracts that require even non-union members to pay fees for union representation. Governor Mike Pence called the decision a victory for every Hoosier in the workplace. The United Steelworkers Union and the International Operating Engineers filed challenges to the right to work law after it was first passed in 2012. The court ruled last month on the operating engineers lawsuit, and its decision this week sends the steelworkers case back to the lower court and tells the judge to dismiss it and end the appeal. Governor Pence says that by this ruling, the court has reaffirmed Indiana law that no Hoosier may be compelled to join a union as a condition of employment, but that every Hoosier is free to join a union if they choose. Indiana AFL-CIO President Brent Voorhees said that though he expected the ruling, he didn't think it would be unanimous. He said that he firmly believes the court's decision is based on a misinterpretation of federal law and that the union is going to keep fighting. Senator Karen Tallian is taking the fight to legalize medical marijuana to the Indiana State Senate. Tallian announced her intention to introduce a bill into the next legislative session to legalize medical marijuana in the state of Indiana. Her move follows this week's congressional passage of a federal budget. A provision in the budget signals an easing of federal restrictions and victory for medical marijuana advocates. It directs the Federal Drug Enforcement Agency to suspend raids on retail establishments in states where medical marijuana is legal. Senator Tallian says public support for decriminalization is definitely growing, and it's time for Indiana to change with the times. California was the first state to decriminalize medical marijuana in 1996. Since then, 32 states have legalized its use. In a major policy shift, President Barack Obama announced this week his intent to normalize relations between Cuba and the United States. The president says he will initiate discussions with Cuba on the reestablishment of diplomatic ties, which was severed in January 1961, work on easing travel restrictions between Cuba and the United States, and facilitate the resumption of commerce between the two countries. The announcement hits home for Cuban Americas right here in Northwest Indiana. Since 1919, the International Community Alliance in Gary has been working with Latino communities throughout Indiana. Executive Director Lawrence Sharp says the Obama policy change will definitely have an impact for Cuban Americans locally.
They do love their country. They like to see their country prosper. As I said, I have an employee who's a Cuban national, and she's elated. She went right to Facebook and announced it to everybody. But her mother couldn't come here because the Cuban government refused her entry into the United States. And so now this makes a real big difference for her. She doesn't really want her mother to live here, but she wants her mother to be able to come and visit.
Sharp says that many Cuban Americans are excited about the change and feel that the former U.S. policy toward Cuba was antiquated. As local Cuban Americans look optimistically towards the future, a local lawmaker is working hard to provide an edible Christmas present. Democratic State Representative Vernon Smith of Gary is preparing his annual Spirit of Christmas dinner, and he needs help from the community to make it a success. The dinner will be served Christmas Day inside the Ivy Tech Gary campus building. While primarily for residents of Gary and surrounding cities, Smith says anyone from the region is welcome to share in the holiday and enjoy a good meal. The dinner is an important part of Representative Smith's Christmas tradition. He holds the dinner every year in honor of his mother, Reverend Julia E. Smith, and Patricia Tillotson, a teacher who made a significant impact in his life. If you'd like to volunteer, make a reservation, or get additional information about the Spirit of Christmas dinner, you can find out more by calling 219-887-2888. 2046. If you want information about the health risks attributed to smoking, you don't have to look far at all. Hillary Powell says despite mountains of evidence about the risks, Hoosiers still find it hard to kick the habit.
It's a deadly routine more than 1 million adults in Indiana still do, according to the Indiana Cancer Consortium. The state's smoking rate is among the highest in the nation. The new year often brings fresh resolutions, including snuffing out smoking. I spoke to local experts about ways prevention groups are trying to smoke preventable deaths. 1 year ends, another resolution begins. That is a typical pattern for many residents wanting to make a change, including smokers looking to put out their toxic habit. Ronnie Ford, the statewide tobacco and prevention cessation manager for the Indiana Black Expo, says the will to quit can come from a simple text.
You may get text messages, you may get phone calls to help you when there's times of day when you're most likely to smoke. Most people smoke because through habit. You get up first thing in the morning, you want a cigarette. Well, maybe you'll get a text instead to say, hey, how's your day going? You know, did you get some coffee?
The tool is a tactic of the Indiana Quit Line, a service of the Indiana State Department of Health. It's free to anyone referred by an organization in the Hotline's provider network.
These are actual behavior cognitive coaches that are coaching people through this issue, and they are coaching them with techniques, evidence-based techniques that will help that person through it.
It's a line cessation experts want more Hoosiers to use. A study released this month by United Health Foundation found about 1 in 5 Indiana adults smoke, a number down 14% since 2012, but still higher than the national average. Ford says tobacco's toll is especially harsh on African Americans.
Even though we may smoke sometimes at even a lower rate than our counterparts, it affects us much more negatively.
Among the State Department of Health's priorities for 2015 is to eliminate minority health disparities related to tobacco use. Ford says start by targeting merchandise marketed to children and teens.
These are cigarella products that come from your neighborhood convenience store. We have whipped cream flavor, we have pumpkin spice, we have fruit punch. These are actual flavors that our youth are looking at each and every day and are looking at. This is obviously something good because it's got flavors and it's in the convenience store and it's cheap. And so it gives our youth the impression that I can start using these products. Most of the time they move on to cigarettes, and they also do them in conjunction with cigarettes.
A new PSA created for Black Expo chapter markets, including East Chicago and Gary, is another way experts hope to deter young Hoosiers before they grow up and light up. Franciscan Alliance Director of Respiratory Care Michael Meska says the region has among the highest smoking rate in the state. Franciscan's Northern Indiana Health Centers offer a new screening of lung cancer in an effort to catch the early stages of the disease, often linked to smoking.
What it does, it finds nodules at an early stage when lung cancer is not presenting itself through symptoms, but it's perhaps present, and when we catch it early, we can treat it more aggressively.
Meska hopes the screenings will become more routine for people aged 55 and older or current and former smokers. And he says a clean screening, especially for current smokers, is not a license to light up.
Deaths by lung cancer exceed the deaths from the next 4 cancers combined. There's a tremendous amount of energy and attention given to breast cancer, colon cancer, prostate cancer. All those cancers combined don't equal the same amount of cancer deaths from lung cancer. Number one preventative thing that we can do is not smoke.
Experts encourage those wanting to stop smoking to contact the Indiana State Department of Health's Tobacco Control Program at www.in.gov. Well, 50 years ago, the Surgeon General released the first report on smoking and health in the United States, warning of the harmful effects of cigarettes. A recent study examined whether efforts to control cigarette smoking over that time period has helped to extend people's lives and improve their health. Catherine Dolph explains in this week's JAMA report.
I've smoked for about 20 years.
I've never smoked before.
I've tried to quit, but I never succeeded.
I don't smoke because I think it's unhealthy.
Whether you smoke, have quit, or never started, smoking continues to be a significant cause of death in this country.
Hundreds of thousands of lives are lost prematurely each year because of smoking.
However, efforts by the government and private organizations to control tobacco, in particular smoking, has changed over the last 50 years since the U.S. Surgeon General released the first report on the harmful effects of cigarettes. Dr. Theodore Holford from the Yale School of Public Health and co-authors compiled smoking histories and analyzed numerous surveys, many of which had asked detailed information about whether people smoked, when they began smoking, and when they quit.
Between 17 and 18 million deaths were associated with the use of tobacco, of cigarette smoking. An additional 8 million would have died, we estimate, had this tobacco control not occurred.
The study appears in JAMA, Journal of the American Medical Association.
And on average, we found that 19 or 20 years of life were gained by the individuals who avoided early death by quitting smoking or never starting.
At 40, men live almost 8 years longer today than they did 50 years ago. Women between 5 and 6 years longer. Without tobacco control efforts, men would live about 5.5 years longer and women about 1.5 years more. That's close to a 30% improvement in life expectancy. While the progress made seems encouraging, Dr. Holford says there is still a lot to be done, and advice for smokers and non-smokers is the same.
For both men and women, about 30% of that improvement in life expectancy we estimated was accounted for by the changes in exposure to cigarette smoking.
My advice is just don't start.
Someone who's considering smoking should not consider it ever.
Don't start. Don't start.
Catherine Dolph, The JAMA Report.
Study authors say even with all the gains, nearly a fifth of adults in the U.S. continue to smoke. A number of critical factors are affecting the health and well-being of area children. Steve Walsh spoke to Northwest Indiana Times reporter Mark Chase about the paper's in-depth series, What's Killing Our Youth?
Between 1999 and 2010, 2,053 Northwest Indiana youth died. The Times of Northwest Indiana has been running a series looking at the reasons. In some ways, it confirms some of the things we know. Indiana has a very high infant mortality rate. To talk about it, we have Times columnist and investigative reporter Mark Chase.
Hi, Steve.
Hey, Mark, welcome. Indiana is like, what, the 7th highest infant mortality rate in the country. It has had a very high infant mortality rate for decades. It's traditionally. And that's also the leading cause of death here. Almost half of these children.
In fact, a little bit more than half, yeah.
Okay. Do we find out a little bit more about why it's so high?
Well, a little bit. I mean, there's a lot of different causes that play into that infant mortality. A lot of it's, premature birth. That's a leading cause within a sort of a sub-cause within that category. Infant birth weight is one of those things that they look at as a risk factor to infant mortality. And we have a higher rate of that here than the rest of the state even. And if you look at the children that died before their first birthdays and you look at it as a rate, I believe it was about 9 out of every 1,000 in the population, children that died within the 12-year period we looked at. In the state, it's about 8, and in the nation, it's about 7 for the same time period. So we're outpacing the state and nation in that category as well.
And is that just we don't have really good neonatal care here? Moms are not getting in. They don't understand how important it is to take a baby to term?
That's something that the state's looking at right now. It's a pretty well-timed series because the state health department have been doing a new study where they've been marrying different categories of data together that really haven't communicated with each other before. Things like Medicaid data versus birth weight versus a lot of different things. And they're going to try to piece that together and figure out what to do about it.
Right, get some really good numbers, though we already know that we have a higher smoking rate among women who are pregnant than the national average, and that usually contributes to low birth rate.
It does. And there's socioeconomic issues there, too. I mean, we have a very big urban core here in Northwest Indiana.
But number 2 was behind that was accidents, just simple accidents.
Yeah, well, and accidents is not sort of a simple category to look at because, the traffic accidents were the leading sub-cause within that set, but accidents include a lot of things. They include drownings. They even include drug overdoses, which, weren't terribly high when you consider it against the traffic accidents, but there's a lot of different things that play into that category. I think there were over 400 Lake Porter and LaPorte County children in that category that died in the time period.
So what's your takeaway? In the end, was it valid to look at just the children who had died. Do you learn anything from that?
I think so, simply because it shows you how different the causes are than the adult causes. I mean, the overall causes of death, the leading one is heart disease, second one is lung cancer, which is, of course, smoking. Cancer as a whole is the second, but lung cancer is the biggest subset. Alzheimer's is in the top 4. For children, you're talking about dying before your first birthday, you're talking about accidents, and you're talking about assault and then cancer. Very different for the most part.
You interviewed mothers that had lost their children in that first year, and they were just bereaved and remain that way.
Parents from all of these causes, whether it's the child that died in their first year or a teen that died from gang violence, it was really a heartbreaking series to undertake.
Mark Chase, some great reporting, and thanks for doing this.
Thank you.
Kids of all ages can look forward to a concert that puts a jazzy twist on a holiday classic. John Kane talks A Nutcracker Tale on this week's Eye on the Arts.
Edition of Eye on the Arts is Larry Brewer, Artistic Director of the South Shore Dance Alliance. Very nice to have you here, Larry.
Oh, thanks for inviting me.
You've been here before.
Yes.
And on this occasion, we're going to talk about, is this holiday programming we're talking about?
Yeah, we're talking about holiday programming, Cirque du Jazz.
Cirque du Jazz. Yeah. What is Cirque du Jazz?
Well, Cirque du Jazz is a Nutcracker Tale. It's a combination of Ellington and Tchaikovsky's music, and we've put it all together to create a circus environment for the tell the story of the Nutcracker.
Oh, that's fun. I only became familiar with the Ellington version at another concert that you did with the Northwest Indiana Symphony Youth Orchestra a few years back.
Yeah, I think it was in the 40s, I think, that he did it. And again, it's you're not the only person that I've come across that had not heard that music. It's really nice. It's
very jazzy. Yeah, it's got a lot of bounce to it.
Oh yeah.
It definitely lends itself to dance, that's for sure.
Oh yeah.
So is this something you do every year now?
This is the second year that we're doing it, and I think we're going to continue to do it because we're getting a really nice response for it. And I think it's a really good educational tool.
How many kids are involved in the performance?
Oh man, I think about 70.
70?
I think. I'm not sure. It's like when you're in there trying to herd them all around, it seems like hundreds, but it's a lot of kids.
And what ages? What's the age range?
Oh, we got the youngest kids in there like about 4 years old.
Oh wow.
Yeah, and
are they mice?
No, actually, they're like little popcorn girls and stuff.
Popcorn girls. Oh, that sounds fun.
It's well, the Snow is done. Like I said, it's a circus thing. So Snow is the popcorn girls, and so the big girls do that, and then the little kids come out in front of the stage doing scene change, and they get to do some things.
Oh, that's nice. So of all ages.
Of all ages, yes.
Well, good luck with the performance, and I really appreciate your being here to tell us about it.
Oh, thanks a lot.
And thank you for watching. We'll be back again next week with another edition of Eye on the Arts.
Eye on the Arts is made possible in part by South Shore Arts, the Indiana Arts Commission, and the National Endowment for the Arts, a federal agency.
Twice a month, Lakeshore Report teams up with the Society of Innovators of Ivy Tech Northwest to highlight some of the best forward-looking projects and people the region has to offer. Today, we travel to LaPorte, where the team at IU Health is working to create a safe, error-free environment for all their patients.
Most healthcare workers, if not all healthcare workers, go into healthcare because they want to do good and help others. And we need to recognize that's their aspiration, that's their goal and their mission. Nobody wants to make mistakes, but sometimes the systems and processes we have in healthcare, as in many businesses and organizations, lead to errors. And so first, just the recognition that that is the case. And second, then to build a culture around non-punitive aspects.
The multidisciplinary rounds was something that we looked at the evidence that was available, and it seemed to make sense in trying to bring together a team to take care of the patient. We wanted to kind of have a group that sat together and said, okay, this is what's happening with the patient, and trying to move along the care by addressing either the pharmacy concerns or the nursing concerns or quality concerns that might come up.
I think the one that most people can identify with the most readily is medication errors. After one of these disciplinary or multidisciplinary teams took a look at this, the recommendation was that we have a pharmacy tech dedicated to do the history and recording of the medications that patients were on.
Medication errors result in millions of dollars for healthcare nationwide every year, and they can involve adverse events from a patient taking a therapeutic duplication or a medication that they're allergic to, as well as a patient taking medication that they shouldn't be on that could lead to an even more serious risk. We noticed that that was something that we wanted to address at this institution, so we were completed an RIE, which is a rapid improvement event to create the best possible process for safe, quality, and appropriate medication management for our patients.
That's reduced our error rate regarding medications and improved the accuracy of the medication reconciliation report dramatically. It's more than doubled the accuracy, where it's close to 100% now. Eventually we'll get to 100%, but the idea is that some improvement is better than perfection in the short run. So we're not going to wait for perfection. We're going to keep getting to incremental improvement, and eventually we'll get to perfection.
For more information about the Society of Innovators, all you have to do is go to www.nwisoi.org.
Well, earlier we told you about a local lawmaker who wants to legalize a potentially controversial substance. Yesterday we took to our Lakeshore Report Facebook page to ask residents about State Senator Karen Tallion's proposal to make a law legalizing medical marijuana. We received half a dozen responses, and here are a few that we just thought we might want to share with you. Penna Randy, a viewer says, bless her for standing up for our rights here in Indiana. And conversely, on the other side, Ed Freeman shared on our page, don't we have more pressing matters to address downstate and here in NWI, or Northwest Indiana, than this? So two different sides to the equation shared there.
And we love hearing our viewers' comments, suggestions, requests. If you have a response to any story or any kind of a story idea, send them our way. We'd love to hear from you. You can contact us at tvfeedback@lakeshorepublicmedia.org. By the way, we're coming up very quickly on the big time holiday season, and Hillary and I both want to extend a wish for our viewers to have a very healthy, happy, safe holidays. And that means no drinking and driving, buckle up, what else?
Or some resolutions. We were talking about resolutions earlier in the show, and just, you know, trying to look forward to the positive things for 2015, surely.
Yeah, sounds great. Lay off the eggnog. We will see you next time on Lakeshore Report.